got spurs that jingle, jangle, jingle,
Jingle jangle,
as I go riding merrily along.
jingle jangle,
And they sing, oh, ain't you glad you're single?
jingle jangle.
And that song ain't so very far from wrong.
Where you going, Jimmy?
I'm gonna go play baseball.
Attaboy. What first aid is, Jimmy?
No, what's first aid?
First aid is the provision of initial care for an illness or injury. It is usually performed by non-expert but trained personnel to a sick, injured person until definitive medical treatment can be assessed.
Gee whiz, mister. Can I learn more?
Do you know what shock is, Jimmy?
Shock is a medical emergency in which the organs and tissues of the body are not receiving an adequate flow of blood. This deprives the organs and tissues of oxygen and allows the buildup of waste products. Shock can result in serious damage or even death. Here are several types of shock, Jimmy. Going to anaphylactic shock is usually caused by medication, food, insect stings, or bites, or even snake bites. Cardiogenic shock is caused by damage to the heart muscle from heart attack or cardiac arrest. For example, this is Bob. Bob just had a heart attack a few weeks ago, and against his doctor's orders, he thought that he could lose some weight by jogging in the mornings. Let's see what happens. Hemorrhagic shock is caused by severe bleeding or loss of blood plasma. This type of shock is called neurogenic. It's caused by injury and trauma to the brain and or spinal cord. Ah yes, septic shock. Septic shock is usually caused by an acute infection.
And those are the different types of shock, Jimmy.
Wow, mister, that's a lot.
Oh, I forgot one more. Can I see your brother, Abel?
Sure, mister.
Hi, Abel.
Hey, how you doing?
Did I ever tell you that the communists are invading?
See, Jimmy, your brother is now going into psychogenic shock, usually caused by emotional distress such as anger, fear, or grief. Here is my assistant helping us how to proceed in giving first aid to a patient.
Hi, my name is Jasper Blusen, and I'm gonna teach you how to apply first aid when someone goes into shock. I'm going to teach you a step-by-step basis that comes from this book that teaches you how to provide first aid in shock. So America, you guys are wondering who will be our patient for this video this week. Well, we got a lovely special guest from Yorba Linda, California. It is our lovable Vice President, Richard Nixon. Yeah. Hi, Mr. Nixon. Say something to folks back home.
Well, I'm not a crook.
Okay, so Mr. Nixon, I would like to ask your permission. Can I administer first aid upon you while you're going into shock? Okay, good. So, let's start this. Mr. Nixon, would you please kindly lay down like you were a person that seemed to be injured and probably going into shock? Very good, Mr. Nixon. So, we're about to start here, and, well, let's get started. So, shock is a state that can appear during injury or illness that requires first aid. So, you have to be sure that you know how to provide treatment when someone goes into shock while administering first aid. There can be many different reasons why shock occurs. It could be due to excessive pain, blood loss, a heart attack, and all of that crazy stuff. Why is your body going into shock? It's probably because it's trying to increase blood flow to your heart, your brain, any vital organ. But by doing that, it loses all blood flow in other areas. A symptom that may occur during shock is the skin turns pale or bluish gray. As we can see, Mr. Nixon's face looks a bit of gray right now. During shock, the victim can lose consciousness. Right, Mr. Nixon? Yeah, I think he's out. So, you ready to apply first aid? Because I am. Let's start this. Step 1A. Check the scene and make sure it's safe. Seems safe. Step 1C is calling any medical authorities to arrive on the scene. 911, There appears to be a person unconscious on the road, and I believe he's going into shock, so hurry please. Step 1D is to provide any care for the victim. That will be explained through other steps. Step 1E is also to control the severe bleeding. We will visit that again in future steps. Step 2 is very important. The first thing you have to do, even before you check the scene and check the victim, is call 911. Call for medical help right away. This could determine life or death, depending how fast the medical authorities can arrive. And if you believe you can administer first aid to help treat the victim, make sure you ask for permission first. You don't want to get sued, do you? Step 3 is to look for any signs of shock. Look for pale or bluer skin. Is the skin very cool when you touched it? And is it very clammy? To continue on with step 3, you look for the pulse of the victim. First, you start trying to find the radical pulse, whether it be weak, rapid, or irregular. If you are unable to find the radical pulse, find the carotid pulse around the neck. While trying to find the pulse, check for respirations, whether they be weak, rapid, irregular, shallow, or labored. It seems that Mr. Nixon is breathing pretty fine right now. And if you have equipment available, try to check for the victim's blood pressure if you believe it's low. More on to step 3, we check to see if there's any signs and weaknesses with the victim, such as confusion, apathy, or consciousness. Step 4 is you trying to reduce or eliminate the cause of shock. If the victim is bleeding, you try to apply pressure to that side, such as your hand or bandage. You can refer to our bandage from the other projects seen before. If the patient needs oxygen, provide oxygen if possible. Step 5 is positioning the victim based on his or her injuries or illness before he or she entered shock. Scenario 1, if you believe the patient has a neck injury or spine, do not move him or her at all. Scenario 2, if the victim is bleeding or has a broken mouth and jaw or is vomiting, you move the patient to the side, left or right. This allows fluid, vomit, or blood to drain and not block the airways while the victim is breathing, because the fluids would actually get stuck in the airway and it will be a tough time for the victim to breathe. If the victim has a hard time breathing, raise their head a bit back up and make sure their shoulders and hands make it comfortable for them to breathe. You okay, Mr. Nixon? Scenario 4. If the victim has a head injury, make sure to lay them down flat on the floor or raise their head a bit just to give a small elevation. If they don't have any injuries or anything specified by these scenarios, it's best to keep the victim laying down flat and raising their leg 12 inches up to improve circulation, like so. If they complain about breathing or any pain at all while lifting their legs, it's best just to keep them laid flat. And what happens in a scenario you can't tell if they're bleeding or vomiting or anything like the other scenarios we talked about, it's still best just to keep them down flat. If the victim is complaining about chilling, are you cold, Mr. Nixon? You find blankets and you try to cover him from the ground, then over his body. And make sure not to overheat the victim. Are you okay, Mr. Nixon? It's not too hot for you? Okay, good. Step 7. You do not give any food or drinks to the victim. If they complain about thirst, get a moist cloth and dab it between their lips, mouth, and inside their tongue. But you do not feed them or give them any drinks at all. Step 8 is very important. You have to stay calm during the scenario and keep reassuring the victim. Mr. Nixon, everything is going to be great. Is going to be okay. The paramedics are coming soon. Don't worry, you'll be just fine, Mr. Nixon. Step 9 is pretty simple. It's just to provide care and wait till the paramedics arrive. So here we are, step 10. What do you do when the paramedics arrive? Replace all the equipment that you have used upon your victim, Mr. Nixon, and then wash your hands. Back to you, Jimmy. Say bye, Mr. Nixon.
So you really know how to treat shock, Jimmy. You ready to save lives?
Yes, sir. Can I go play baseball now?
Yeah, kiddo, get out of here.
All right.
Wait, Jimmy, wait! One more tip, Jimmy. When you ever see a man laying down on the floor and you know he's going to shock, and you believe that he's a communist, let him die.
Yes, sir.
Now, get out of here and go play baseball.
All right.
Copying this medical film is restricted by federal law. This film is also sponsored by the US government. We like to thank President Dwight D. Eisenhower for the funding of this video. Let's go, President Ike. 4 more years as president.
Ike for president, Ike for president, Ike for president, Ike for president. You like Ike, I like Ike, everybody likes Ike for president. Hang out the banner, beat the drum, we'll take Ike to Washington.
merrily along.
Jingle jangle,
And they sing, oh, ain't you glad you're single?
jingle jangle.
And that song ain't so very far from wrong.